Good evening. This is All India Radio Kohima. I'm Jonas Yandan with Evening News. The headlines. In Nagaland, total number of COVID-19 positive cases rises to 355, with 8 new cases detected. Principal Director Health Dr. Vizolie Suokhrie says PWD Colony in Kohima declared as containment zone due to detection of a frontline worker with COVID-19. ENPO issues 5-day ultimatum to Nagaland government to resolve the Tuensang fiasco. And Prime Minister Narendra Modi to share his thoughts with the people in Mann Ki Baat on All India Radio on 28 June. In Nagaland, the total number of COVID-19 positive cases has risen to 355 today after 8 new cases were detected. Minister for Health and Family Welfare S. Pang tweeted this morning that 8 new cases of COVID-19 have been reported out of the 316 samples tested. He said 5 patients were from Kohima Quarantine Centre and 3 from Dimapur Quarantine Centre. Also in the evening, the minister updated that 12 more patients have been recovered from the infection, 8 from Dimapur, 2 from Kohima and 2 from Bulletin. With this, the state recovery rate is at 45%, having 160 persons being recovered. At present, the active cases now stands at 195 and all asymptomatic cases. Principal Director Health Dr. Vizolie Suokhrie said the increase of positive cases in the state are mostly among the returnees. However, 5 positive cases were detected from among the frontline workers, which include 4 bus drivers comprising of 1 government and 3 private and a receptionist from NHAK. Addressing media persons at Kohima today, Dr. Suokhrie said all the 5 positive cases are local transmission contracted through contact with high-risk returnees. He said there is no cause for panic as the infection is not in the community. Saying that the NHAK employee is a resident of PWD Colony, Suokhrie said contact tracing have been completed and the area has been declared as containment zone. Principal Director Health Dr. Vizolie Suokhrie has lauded the returnees of Mukokchung and Longling districts for showing exemplary behavior in following quarantine protocols strictly. He said comparing to other districts of the state, none of the returnees have been tested positive in these 2 districts. In this, he said, the returnees mostly from Chennai have refused to mix with others and maintained precautions and hygiene. He said such attitude of these returnees have shown a good lesson that all other returnees should have learned to avoid the spread of the virus. On the increase of positive cases among the returnees, particularly Bulletin and Mann, Dr. Suokhrie said most of the returnees have failed to maintain social distancing and quarantine protocols. The principal director therefore stressed upon all to continue to maintain social distancing, saying that all have to learn to live with the virus but also learn the good practices to avoid the infection. The government today said that the COVID-19 recovery rate has reached 57.43% in the country. A total of 271,697 people affected with coronavirus have been cured so far. During the last 24 hours, 13,012 people have recovered from COVID-19. Presently, the total number of active corona cases in the country is 186,514. Health and Family Welfare Ministry said a total of 16,922 new cases of COVID-19 have been reported in the country in the last 24 hours, taking the total number of cases to 4,73,105. This is the highest spike in fresh cases since the outbreak of COVID-19 pandemic in India. 418 deaths have been reported in a single day, taking the nationwide toll to 14,894. 6 tribal bodies, frontal organizations and advisors held a consultative meeting in Dimapur on Tuesday to deliberate on the representation submitted to the state government by the Eastern Naga People's Organization ENPO on 28th of last month, seeking to initiate disciplinary action against the government officers involved in violation of Standard Operating Procedure SOP and directing to transport the returnees to Tuensang from Kohima without waiting for results of their test samples and endangering the lives of many people. According to a press release from the ENPO, after a day-long deliberation on the issue, it was unanimously resolved by a joint consultative meeting that ENPO will wait for 5 days from the date of adoption of the resolution for the Cabinet to deliberate and take necessary action. This news comes to you from All India Radio, Kohima. The Western Simi Youth Front, WSYF, has lamented that some returnees in quarantine centres in Dimapur are disobeying quarantine rules and even confronts the authorities. The WSYF, in a press statement, cautioned all returnees within its jurisdiction, particularly those belonging to Simi community, that if any of them is found misbehaving and going against the instructions of the authorities, would be dealt with in a befitting manner. It stated that if there is any genuine complaint, returnees may intimate them for taking up the matter with the appropriate authorities instead of creating nuisance which might tarnish their own image as well as that of the community. The Youth Front also appealed to returnees of other tribes to understand that steps taken by the government is for the safety of everyone and urged to cooperate with the authorities. It further appealed to the government to speed up the process of releasing those who have completed 14 days mandatory quarantine period to avoid further problems. Prime Minister Narendra Modi will share his thoughts with the people in the country and abroad in his Mann Ki Baat program on All India Radio on 28th of this month at 11 a.m. It will be the 13th episode of Mann Ki Baat 2.0. Modi has invited people to share their ideas for the upcoming episode of Mann Ki Baat. People can dial 1800117800 to record their message and can write on the Namo app open forum or on my GOV. People can also give a missed call on 1922 and follow the link received in SMS to directly give their suggestions. Health Minister Dr. Harshvardhan today launched the e-Blood Services mobile application. It is an initiative of the Indian Red Cross Society dedicated to the fight against COVID-19. Speaking on the occasion in New Delhi, the minister said people in need can get registered on this app and know from where they will get blood. He said people can demand up to 4 units of blood. He added that Indian Red Cross Society's blood banks will wait up to 12 hours for them. Christian Institute of Health Sciences and Research CIHSR, in collaboration with Kohima Circle Task Force on COVID-19, conducted a community COVID training at Kohima Town Council Hall today with the maintenance of social distancing. In his keynote address, ESC Kohima Teja Vizolie Suokhrie said that though the state is still in stage 2, the training program for community leaders was initiated to impart facts and precautionary measures of COVID-19 pandemic, keeping in mind the potential of community spread. He urged the gathering to strictly follow all the safety protocol issued by the government to contain the spread of COVID-19. Head of Anesthesiology Department CIHSR, Dr. Adar Moses, reminded the gathering not to panic but to follow all precautionary measures. The Kohima Smart City Mission has invited interested fresh technical graduates to enroll in its internship program on the Urban Learning Internship Program, TULIP, to get a first-hand experience on smart city projects and also contribute to the company and the people of Nagaland. A press release from Kohima Smart City Mission CEO Kohima said that it has rolled out its internship program on the ministry portal for 8 positions for the state. The release informed that the details of positions, eligibility, terms and conditions and application forms can be availed on the website www.kohimasmartcity.com. It further informed that applications should be submitted online on or before 22nd July. TULIP is a program launched by the Ministry of Housing and Urban Affairs in collaboration with All India Council of Technical Education with the objective of providing a platform to connect fresh graduates with urban governance and to expose young graduates to real-life learning in urban environment. The program intends to fulfill the twin goal of providing hands-on learning experience to fresh graduates as well as benefiting states, urban local bodies and smart cities with infusion of fresh energy and ideas to solve critical challenges. And now it's 20 news. Here are the main points again. In Nagaland, total number of COVID-19 positive cases rises to 355, with 8 new cases detected. Principal Director Health Dr. Vizolie Suokhrie says PWD Colony in Kohima declared as containment zone due to detection of a frontline worker with COVID-19. ENPO issues 5-day ultimatum to Nagaland government to resolve the Tuensang fiasco. And Prime Minister Narendra Modi to share his thoughts with the people in Mann Ki Baat on All India Radio on 28 June. That is all we have in this evening news bulletin. Good night.